To a top story of the day, the deadline is finally here for 6 Mayo Clinic Health Systems campuses across rural Minnesota and the surgery department in Albert Lea to close. Mayo Clinic announced its plans to close these locations back in September, but today it's official. KIMT News 3's Evan Berg joins us live in the newsroom tonight. And Evan, you spoke with some of the cities affected. How are they adjusting to this loss?
I spoke with the cities of Saint Peter and Montgomery, and while both weren't surprised by the news, it is still having an impact. And while there are still healthcare facilities within 20 minutes of the downtown core, it's going to be an adjustment.
Conversations with us were more about not necessarily a lack of patience or people visiting the facility. It was more about a challenge in finding practitioners and support staff.
The city of Montgomery says it wasn't a surprise when it heard Mayo Clinic was going to close its health systems campus. Unlike others marked for closure on December 10th, it closed a month ahead of schedule.
Being New Prague, again, it's not going down to Mankato, but it's still, for some people, it could be quite a distance, especially if they are unable to drive.
The city administrator says the closest campus is now in New Prague. He says it's likely it won't be an issue for most in the town of 3,000 people, but for those in surrounding townships who may have mobility issues or lack transport, it could be a challenge.
So if you don't have a vehicle or you have a hard time getting around, then any barrier that gets put up, like going an extra 7 miles, can be a challenge.
The city of Saint Peter, meanwhile, says it has been luckier than most.
The city owns the local hospital, Rivers Edge Hospital. We have other general practice doctors.
But St. Peter's city administrator says it's still likely to be an adjustment.
We certainly expect that there will be patients that will be looking for a new home for their primary care, their general practice care. We expect that will happen, whether they get that in St. Peter with other practitioners, whether they follow their practitioner to the location where their practitioner is going. We have a number of doctors that practice out of that clinic that have been in the community for, frankly, more than a decade or two.
And the city of Montgomery says many of the physicians at its Mayo Clinic campus were given the option of relocating to that New Prague campus. A similar offer, according to the Minnesota Nurses Association, was given to its staff at the Albert Lea surgery office to relocate to either Waseca or Austin. Back to you, Cammie.
Evan, question for you. Do you know, did any of those folks choose to relocate?
According to MNA, some of them did end up taking that offer.
Okay, good to know. Evan Berg joining us live in the newsroom tonight. Evan, thank you so much. And when we hear this story, many of us think, well, why exactly is this happening? Mayo Clinic said in the announcement to close these campuses, this decision was to maintain high-quality coordinated care while expanding flexibility at its remaining locations